On September 14th of 1936, Walter Freeman forever changed the history of psychiatry when he performed the first lobotomy in the United States on housewife Alice Hood Hammett with the help of partner, neurosurgeon James Watts. But what was this procedure? Was it as demonic as people now believe? And most importantly, did it help the patients? We'll explore this and more in A Cut in the Right Direction, A History of Lobotomies in America.
In the early 1900s, the medical understanding of the brain was limited, and people would often go to drastic measures to cure common mental illnesses. The lobotomy we now know in America was based off of the procedure Egas Muniz in Portugal created, called the luectomy, in which the doctor would drill small holes or remove with a knife small chunks of the skull, and then insert an object used to sever the nerve fibers in the frontal lobes of the brain. In the 30s, Walter Freeman brought the procedure to America and renamed it the lobotomy, modifying the procedure by completely severing the frontal lobes. 10 years later, Freeman perfected his new modified version of the lobotomy, the transorbital or ice pick lobotomy. The procedure only took around 10 minutes, the length of this video, and began with several rounds of electroshock therapy used to render the patient unconscious. Then an ice pick would be inserted into the eye socket above the eye and pushed back into the brain by hitting the ice pick with a hammer. They would then move the ice pick back until the frontal lobe was completely severed. This particular form of lobotomies was based off of the Phineas Gage case study, a railroad worker who, due to an explosion, ended up having a piece of rail going through his brain. In the 1950s, this procedure became a major fad in psychiatry, and over 3,500 patients received a lobotomy from Walter himself, including several famous actors and President Kennedy's sister, Rosemary Kennedy.
Since the lobotomy has been shown to reduce the mind to that of a child, it was often used to cure mental illnesses as common as depression, anxiety, and pain, and mental illnesses as severe as schizophrenia. In several extreme cases, it was also used to quote-unquote cure homosexuality. Many people now believe that once lobotomized, the patients essentially turned into vegetables, largely due to this scene from the popular film One Flew Over the Cuckoo's Nest, based on a book by Ken Casey. However, the range of effects was much more extensive. Tim Banky, a neurologist at Children's Hospital, said,
"It was found that doing this procedure, it would limit how much people would respond to different things. And the usual side effects is that people would have very blunted emotions or a lack of emotion afterwards. In other words, the patients were often apathetic."
In An Interpretation of the Function of the Frontal Lobes by James Watts and Walter Freeman, it was noted that after a lobotomy, there is a particular flattening of the voice, with abrupt termination of sentences, and inability to carry on a conversation. They thumb the pages of magazines or look over the newspapers, but are unable to recall what they have read. Soon it was proven that, at best, they only helped 1/3 of the patients, with irreversible brain damage often the outcome.
In certain instances, the lobotomy was chosen for a patient by their parents' offspring, spouses, or the government. Because the choice was made for them, these patients oftentimes had no knowledge of why this procedure was chosen for them, and sometimes had never even discussed having the operation. With such high chances of the procedure going wrong, and such minor reasons for undergoing it, we now understand how unconstitutional these cases were. One such example was Howard Deli, whose stepmother Lou Deli was convinced that Howard needed a lobotomy because he was, to quote, defiant and savage looking, and didn't react either to love or punishment. These are pictures of Howard. It is suspected that Lou Deli took him to multiple doctors who believed that he was fine, before she found one who was willing to operate on him, Walter Freeman. Later in his life, Howard Deli has expressed his feelings about the lobotomy, saying, "I've always felt different, wondered if something's missing from my soul." He's been riddled with questions all of his life, such as, did I do something to deserve this? Can I ever be normal? And why did my dad let this happen? Howard believes that his stepmother pushed for the lobotomy because she wanted to turn him into a vegetable, and his father claims to have been manipulated into it. However, despite the procedure, Deli is now a husband and a father who has written a book on his experiences called My Lobotomy, a memoir. One of the least well-known facts about lobotomies that the Wall Street Journal uncovered is that after World War II, the Veterans Administration lobotomized over 1,464 returning soldiers who exhibited signs of what we now know to be PTSD and other mental illnesses. Roman Tritz, the veteran in these pictures, said in an interview about his lobotomy, "I've never had a headache like that before. Never made sense to me. I can't see why by giving you any less brains would help."
However, sometimes lobotomies produced good results. One such example was Ellen Linesco, who received her lobotomy on January 17th of 1946 by Walter Freeman. Her daughter, Angeline Forster, was quoted saying, "She was absolutely violently suicidal beforehand. After the transorbital lobotomy, there was nothing. It stopped immediately. It was just peace. I don't know how to explain it to you. It was like turning a coin over, that quick. So whatever he did something right." Even Ellen Linesco herself has positive views on Dr. Freeman. He was just a great man, that's all I can say. Yet the fact remains that through these procedures, the rights of hundreds were stripped away. As it is written in the Declaration of Independence, we hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness, that to secure these rights, governments are instituted among men, deriving their just powers from the consent of the governed. How is it that a government which derives its power from the consent of the governed was allowed to perform a surgery without consent on its own veterans, which left most of them with serious brain damage? Although it is true that the government or the family of a mental patient are allowed to intervene on their behalf if the person is incapable of making decisions for themselves, many of these patients who went under the knife or the pick unwillingly suffered only from depression or common anxiety disorders. And although many patients had these procedures willingly, the government should have seen how greatly the unsuccessful cases outweighed the successful ones, and should have outlawed the procedure as malpractice for common afflictions. It is undoubtedly the responsibility of the government to regulate medical procedures and ensure that the mentally ill are protected under the law. The history of this procedure has forever changed the way modern psychiatry reviews practices before making them available on a large scale.
Walter Freeman was banned from operating in 1967 due to one of his patients hemorrhaging while receiving her third lobotomy. He was then later forced to retire. Although they were never formally banned, today lobotomies are extremely rare and much safer. They're only used if the patient has tried every other form of treatment and willingly consents.